Hey guys, so I know everybody's been inundated with in-services, but I got just one more for you. It's about the Richmond Agitation Sedation score. So I just want to tell you a little bit about it and how to correctly score for our patients. And I'll leave this in the fishbowl so that you can sign my roster. Please sign my roster. Okay, so the Richmond Agitation Sedation score was created by a group of doctors and nurses and pharmacists as a way for clinicians to convey what their patient's sedation and agitation was. So we use it to set goals for the medications that we use to sedate our patients, and as a way to minimize and get our patients at that optimal level of sedation. So it's kind of the rationale to why we're titrating our medications. Like we do pain assessments for pain medications, this is our agitation sedation assessment for our sedation medications. So how to score it, I have a little drawing. So it's on a scale from +4 to -5. The positive numbers are agitated and the negative numbers are sedated. So if you start by observing your patient. When you walk into the room, if they are alert and calm, they're 0, which is awesome. The next thing you do, you want to call their name loudly and ask them to make eye contact with you. So if they make any response at all, they're going to be at least a -1, 2, or 3 for this area. So if they respond with eye contact greater than 10 seconds, that's a -1. If they respond with eye contact that's fleeting and less than 10 seconds, it's a -2. If they respond but they don't make any eye contact, then that's a -3. If they respond to only physical contact, physical stimulation, then they get a -4, and no response at all is a -5. So no response to verbal or physical stimulation. On the positive side, if they're just a little restless but not trying to pull anything out, they get a +1. If they're frequently agitated, getting a little dysynchronous with the ventilator, then they're going to be a +2. If they're getting more agitated, starting to pull at things, they by themselves a +3. And then if they're really combative and an immediate danger to staff, then they're a +4. So our goal from this, we want our patients to be +1 to -1. So it used to be +2 to -2. However, the latest literature supports +1 to -1 because the least amount, you want the minimum amount of sedation to keep your patient comfortable, and that's going to decrease your ventilator days. It's going to decrease your ICU days, decrease delirium, which is going to optimize their outcomes in the long run. So that's a pretty hot topic today. So where do we find our orders? They're included in your power plan for your adult crit pain, sedation, agitation power plan. So, and it tells you right there with your sedation medications that your goal is a +1 to a -1. So y'all check that out. Make sure you sign my roster. Thanks.